Mercy, mercy, mercy. You came down as a mercy.
Radio Al Ansar, Durban, 90.4 FM. Peter Maritzburg, 105.6 FM.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and it is your guidance that we seek. Ya Allah, keep us in a straight path. Ya Allah, show us the choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alayhi wasallam. It is time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh, and we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam, and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is multiple sclerosis, and our guest this evening is Dr. Hoosain Paruk, a neurologist in private practice practicing in Pietermaritzburg. Dr. Hoosain Paruk, Assalamu alaikum wa rahmatullahi wa barakatuh, and Jazakallah khair for joining me on Medical Files.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I did introduce our topic as multiple sclerosis, and I think let's start off our discussion by maybe explaining to us what is multiple sclerosis.
Right. So multiple sclerosis is a disease that is characterized by inflammation that occurs within the central nervous system. So what actually happens, it's an immune-mediated disorder. In other words, our own immune system attacks the nerve cells and their extensions, the connections, what we refer to as the axons. It actually affects the coverings of these axons, which is myelin. So that's why multiple sclerosis is called a demyelinating disorder of the central nervous system. And it can affect it in different parts of the brain. Hence, that's where the word multiple comes about. Mm-hmm. And when it affects, it injures it, the immune system attacks these areas and results in very literally simply what we call a scar. And the scar is referred to as sclerosis. So that's how the term multiple sclerosis comes about.
But this is all internal. You're not saying anything externally.
No, it's internally in the brain. It's affecting the brain cells and the connections between the brain cells.
So if I've got this particular condition, how would it present itself? What would be the symptoms?
So the symptoms will be dependent on which part of the brain is affected, and therefore that particular part of the brain has a certain function, and so it would manifest in that manner. Common symptoms that are often experienced include disturbance to the vision. Mm-hmm. So this is due to involvement of what we call the optic nerve. So the optic nerve is actually an extension of the brain, which carries the impulse, this light impulse from the eye to the brain. So one may experience decrease in vision, generally of one eye, but it can sometimes really affect both eyes. Mm-hmm. It can at different times affect the eyes sequentially. There can be other disturbances of vision, such as a person may see double of a particular object, what we refer to as double vision or diplopia. Mm-hmm. Mm-hmm. And other types of symptoms that may manifest would include weakness of a particular region of the body, numbness, incoordination, slurring of speech, or even sometimes just pain.
So I think that explains why you say multiple, because all different aspects can be affected.
So different areas of the brain can be affected with the scar tissue. Mm-hmm. What generally happens is that you can have one episode, you can recover, and then you can have further episodes.
Now, when you say one episode, you mean you'll probably experience a particular symptom.
You can experience one symptom or even more than one symptom. Mm-hmm. So one episode is what we would refer to as a relapse, generally. And then, so the one may recover from the relapse, one generally does recover from the relapse, although the recovery may not be 100% complete.
Okay. Now, what causes this particular condition? Is it something that's hereditary, or is something that you can get by eating the wrong stuff, or what causes it?
So we're not exactly sure what the exact cause is, but in general, the theory is, the hypothesis is that it's due to a combination of both genetic as well as environmental factors. So when we look at genetic factors, we mean that there may be a certain constellation of genetic factors that a person inherits that makes them predisposed to developing the condition. If we look at, for example, twin studies in identical twins, if one twin is affected, then the other twin has a 1 in 4 chance of also being affected, as opposed to in the general population it would be 1 in 33. If a child is born to parents who have multiple sclerosis, then again that child would be at an increased risk. Or similarly, if a first degree relative is affected with the condition, then there is a slightly higher risk for the person to have multiple sclerosis. So there are certainly some genetic factors. Then when we look at the environment, right, so this may be due to exposure to certain toxins, infections, or various different factors. Of late, there's been much research into one particular virus called the Epstein-Barr virus, EBV for short. Now, this is an ubiquitous virus which we all contract, or most people will contract, and often is contracted in early stages of our life. But we're finding the theory now is that possibly there's a abnormal immune response to this virus in a certain person who has a genetic susceptibility that leads to this condition of multiple sclerosis. By the way, EBV has also been linked with certain cancers, blood cancers. There's certain other theories about causation. So, for example, people who live further away from the equator, right? People of North European descent. There's a theory about vitamin D deficiency. So, but again, this might be just related to the fact that those who are further away from the equator are exposed to less sunlight. But by and large, at the moment, most of the research is centered around the genetic susceptibility and this possibly the Epstein-Barr virus.
Now, how common is this, or how rife is this?
So it's worldwide, it's estimated that there's probably about 200 million people affected.
200 million?
Yeah.
Okay.
Right. So sorry, 2 million people affected.
2 million people.
Yeah,
sorry.
that would make it 2 billion. Just 2 billion people. So it's not extremely common, but nor is it uncommon. Just to put it into context, for example, in South Africa, we would have more people infected with HIV than we would have globally who have multiple sclerosis.
Okay. So it's not something that's very rife.
Well, it's more rife in certain areas. Yes.
But talking about South Africa.
In South Africa, generally, it's not very common. So it's not very common in our local population.
Okay. And, you did mention that some people develop it as they grow up. Yeah, so my question to you is, are you born with it, or it is something that you acquire as you grow up? And what age is mostly affected? And when can you sort of diagnose it, if I can put it that way?
So diagnosis is most commonly made in young adults. So generally between the age of 20 to 40.
Okay.
However, it can occur at any age. And yes, there are documented cases of it being diagnosed in childhood as well. So it's something, as I said, you're not born with the condition, but you're born perhaps with a genetic predisposition or susceptibility, and then you may acquire certain infections during your lifetime or be exposed to certain other environmental factors which then trigger the onset of the disease.
Now, is this something that is new, or has it been around for a while?
So we've known about it for a long time. First descriptions were given by a person called Jean Charcot, a Frenchman. He came up with the term. He gave the first description. For a long time, there was no actual treatments available. But over the past, I would say, 3 decades, there have been progress made in terms of the treatment available. And also the understanding of the disease has also increased tremendously in the past 20 to 30 years.
Now, supposing I've got some of these symptoms, obviously this condition will be far from my mind. If I've got double vision, I'm probably going to go to my optician or my ophthalmologist. I'd rather go to my ophthalmologist. Optician might make a spectacle of me, so let's go to him. But are they then going to probably refer me to somebody else to say, look, maybe this is the condition that wants that they need to look into?
Yeah, so the symptoms I've mentioned are quite varied. They're non-specific. There's a lot of other things that could be causing it. So generally, a person would go, perhaps to the general practitioner even, and it really just does depend on what combination of symptoms occur and what course they take. So is it something that comes and goes? Is it getting worse? But you are right in that there is sometimes often a delay in recognizing that these symptoms are actually as a result of a condition like multiple sclerosis. And it's found that generally people would go to a doctor at least 5 or 6 times or various doctors before they eventually get referred to somebody who can actually make the diagnosis.
And I think that particular person is a neurologist.
So yes, generally the diagnosis would be made by a neurologist.
What happens once you've made this diagnosis? I mean, what's the step forward from there?
Okay, well, let's talk about how we would make the diagnosis first.
Okay.
So the diagnosis would be based on, firstly, obtaining the history of what symptoms are there and how they have been evolving. Clinical examination. Sometimes we can find certain findings that are not evident to the patient. So sometimes, for example, the involvement of the optic nerves, the decrease in vision may be so slight that the patient does not even notice it themselves. So a neurologist would generally order an MRI scan. Now remember that MRI scans only came in vogue in the past 20 years. So prior to that, they had to rely more on the clinical skills or the use of CT scans.
Okay.
So neurologists would generally order an MRI scan. They would also order, in most cases, a lumbar puncture. So the idea of ordering the lumbar puncture is, one is you want to exclude other diseases, right? And then the other is to look to see if there's a production of certain antibodies within the central nervous system itself. So this is something that we refer to as oligoclonal bands. And it's not specific for MS, but it's strongly suggestive. One may also order certain tests that evaluate the functions of certain nerves, such as the optic nerve or the auditory nerves. And then other blood investigations may also be ordered, again, more to exclude other conditions rather just to confirm the multiple sclerosis itself. So once these steps have been taken, and generally in neurology we use the term, one needs to prove dissemination in time and space. In other words, once one proves that there has been different so-called attacks that have occurred in different places of the brain at different time points, then that's good grounds to make a diagnosis of multiple sclerosis, provided that one has also excluded other mimics.
Just to remind our listeners that this is an interactive program, and if you have any questions on multiple sclerosis, you may forward them to us via WhatsApp on 060 904 1056. I repeat, 060 904 1056. Our topic for discussion is multiple sclerosis. Our guest this evening is Dr. Hoosain Paruk, a neurologist in private practice in Pietermaritzburg. Also, to remind our listeners that doctors and guests on the Medical Files program will help you with any medical problems you pose by giving you advice on air. However, they do not have your full medical history and have not examined you. Please verify the advice given to you on air with your regular doctor who knows your medical history, allergies, etc. Neither the doctors nor the relevant radio station nor the Islamic Medical Association of South Africa will take any responsibility for any adverse reaction caused by the advice given on Medical Files. So just a reminder, if you have any questions on multiple sclerosis, you may forward them to us via WhatsApp on 060 904 1056. Now, Dr. Paruk, now that you have told us the test that you would do, that you'd conduct, the one question that comes to mind is that it appears, and I'm asking you as a lay person, that you will first want to exclude everything before looking for multiple sclerosis. I said it appears because that's how I understand it.
It's important. It depends. There are there are situations in which the diagnosis looks fairly straightforward and is multiple sclerosis even before one embarks on doing the test. But it's nice to be thorough and to make sure that one is not missing other conditions, because the treatments can be different. also, when we're talking about who does this condition affect, and I briefly alluded to it earlier, people of North European descent. So, for example, if I'm going to find, let's say, a child who's not of North European descent, then I need to make sure that I'm not dealing with another condition.
Okay.
If I'm finding an older person who's not in a typical age group, so in other words, if I've got somebody who's not a typical demographics, and then I will just have I have to make sure that I'm not excluding other conditions. For example, there's it was very common in Japan, and they referred to a particular, what they thought was MS, as an opticospinal variant of multiple sclerosis. In other words, it was generally found that the nerves to the eye, the optic nerves, were affected, and the spinal cord was affected. So it was referred to as an opticospinal variant. And we even noticed this in people here locally in South Africa. And it was only until about 20 years ago that we discovered that this is an entirely different condition.
Okay.
With the discovery of an antibody, its name was aquaporin 4, and we've now actually termed, so this disease is completely separate. It's called neuromyelitis optica, and the way it is caused is different. The treatment is different. In fact, the treatments that one normally uses for multiple sclerosis might worsen this condition.
Okay.
So that's just one example of another condition that needs to be clear. But there are in fact others.
Whilst you're on, do you want to discuss some other conditions which might be similar?
So one is this neuromyelitis optica. It was also previously known as de Vick's disease.
You were worried. I'm gonna ask you what's it called in Japanese, isn't it?
Sometimes there are certain types of strokes, right? Like, there's one inherited condition which results in multiple small strokes in the brain, referred to as CADASIL. That can look like multiple sclerosis. There are other conditions that can maybe due to other immune-mediated problems, leukoencephalopathy, sarcoidosis. Look, these conditions are rare, but it's important for the specialist to know about them and to make sure that they have been excluded before one applies the label of multiple sclerosis. When it and among the things that we would look at is the pattern of involvement in the brain, the spinal cord, and the lesions that we are seeing, or the so-called scars. With time and with the advent of MRI, we've got a lot more information now that helps to guide us that these lesions are looking typical for multiple sclerosis. Prior to the advent of MRIs, there was a certain set of criteria referred to the Poser criteria in the 1980s, which they used to use. But then subsequently, with the advent of MRI scanning, the diagnostic criteria have been revised in 2000, and then subsequently again in 2005, 2010. So we've got a good set of diagnostic criteria to use to confirm the diagnosis of multiple sclerosis.
Question comes in from a listener. Assalamu alaikum. I have multiple sclerosis for over 20 years. And as the years have gone by, I feel like my fatigue levels have just increased. Any suggestions as to what I could take to assist? Jazakallah.
Right. So I think the listeners bringing up now an important point, because I was mentioning now the symptoms that we're generally attributing to the relapse. But at the same time, we also get these other symptoms long-term which people with MS have to live with. And fatigue is a very common complaint. So yes, there are medications that can be used to try to assist with the fatigue. Something, for example, that is used is modafinil. Amantadine can also be used. So, it's always, I would recommend the listener to attach themselves to a neurologist to get the full history of what's happening and make sure that the drug that's appropriate for that individual is prescribed.
Is that also because of proper interaction with other drugs and things like that?
Yes, and sometimes it's a trial and error basis. You have to use one drug, there may be side effects to it, then you have to switch to another drug, and so on.
It appears, Doc, that fatigue seems to be something that's quite common.
It's a very significant complaint with patients of multiple sclerosis. And I think sometimes they become frustrated with it because outwardly their body seems quite fine. So we use a scale referred to as the Expanded Disability Scale, the EDSS, to assess the severity of involvement in patients with multiple sclerosis. So it's a scale from 0 to 10. Sometimes a patient can have a relatively low score and they look quite well because they're fairly independent in everything. But here they are complaining about the fatigue or pain. And sometimes people may dismiss their complaints and think that this person has got nothing wrong with them, just trying to take advantage. Whereas those symptoms are actually very real.
Dr. Paruk, we're going to take an ad break. We'll continue on the other side of this, inshallah.
Discover our new range of exotic perfumes, ouds and bukhur, straight from Dubai, now available at Wonder Dates. We stock a wide selection of Nabil and Chris Adams fragrances, perfect for your unique lifestyle. But that's not all. We also cater to your Islamic lifestyle needs with prayer mats, tasbeehs, dua stickers, bukhur burners and miswaks. Looking for herbal capsules and essential oils? Look no further. Experience the beauty of Wonder Dates. Shop now and elevate your senses.
Shimmer, sparkle, captivate. Nothing less than a masterpiece. Droplets of gold inspires precious design. Platinum bursts with intricate freshness. And every pure diamond becomes more than just a girl's best friend. Voda Gold Gem Jewelers, where timeless dreams become a reality. We tailor-make designer gold, platinum, and diamond jewelry. Trade in or remodel your old gold. Clad yourself with classy name-branded watches. We offer insurance valuation and free zakat calculation. Visit us at 534 Ridge Road, Overport, or call 031 208 9142. Voda Gold Gem Jewelers, manufacturers of fine gold and diamond jewelry.
At Al Ansar Outreach, our commitment to serving those in need is unwavering. We have now updated our Zakah banking details, making it easier than ever to contribute to our noble charity drives. Bank, First National Bank. Account name, Zakah Al Ansar. Account type, check account. Account number, 631 002 03065. Branch, Florida Road. Join us in our mission of giving back, one act of kindness at a time. Thank you for your continued support and generosity.
Famine, conflict, and severe economic decline make the humanitarian crisis in Yemen the worst in the world. More than 20 million Yemenis do not know where their next meal is coming from, and over 10 million are suffering extreme levels of hunger. With your support, the Al Imdad Foundation delivers essential food aid to starving Yemeni communities. It's a question of survival. So let's do what's right. Donate online at alimdad.com or call 0861 786 243 for more information.
Across the world on radioalansar.co.za.
You're listening to Medical Files, and Medical Files is brought to you by the Islamic Medical Association of South Africa. This is an interactive program, and we are discussing multiple sclerosis. Our special guest is Dr. Hoosain Paruk, a neurologist who practices in Pietermaritzburg. And if you have any questions on multiple sclerosis, you can forward them to us via WhatsApp on 060-904-1056. Now, Dr. Paruk, who does this condition affect? And I'm also I want you to even tell me, as far as males and females are concerned, maybe certain demographics if you want to. I know you spoke about North Europe, but more locally.
So again, here in this country, for example, we would find that it's more the white population that we would see the majority of cases, followed more then thereafter by among coloreds and Indians. In terms of gender, females are more likely to be affected than males by a ratio of approximately 3:1.
Oh, okay.
Right. And then, as we said earlier, it's generally the young adults in whom we see this condition. Something interesting that's also been noted is that a person generally, if, for example, they were born in South Africa, then went to the UK, stayed there for some time, when they come back, they can actually bring back the higher risk from that country with them. This might just be a reflection of the environment that they're exposed to them and what they, perhaps coming back to the EBV theory, that perhaps they contracted it there in that environment. But again, it just brings the whole interplay of genetic factors and environmental factors. It stresses the importance and interrelationship of the two in predisposing one to developing this disease.
Now, you did mention that females are more disposed to it than males. You said something like 3:1. So obviously the question of pregnancy comes in. The relationship between MS and pregnancy.
So, firstly, it is possible for patients who have multiple sclerosis to fall pregnant, although there is a chance of then passing on, of that child having a slightly higher risk of developing multiple sclerosis, but it's not 100% thing. The decision to fall pregnant is an individual one, depending on the state of health of that particular individual and whether they feel they would be able to adequately take care of the child and so on. So it's not different decisions, different people.
But what about the threat to the mother?
So pregnancy is what we would refer to as an immunosuppressed state. One's immune system is actually a bit weakened, dampened. And we said that in multiple sclerosis, it's the immune system that actually attacks the nerve cells. So the risk of having an episode, a relapse during pregnancy is in fact less.
Okay.
Right? So in that sense, it's a positive. However, shortly after the pregnancy, there's a rebound effect. So there's a risk of having a relapse shortly after the pregnancy.
Okay.
That's one aspect. The other aspect to consider, well, we haven't spoken about the treatments as yet, but they're generally not licensed for use during pregnancy. In fact, most of them cannot be used if a person is pregnant.
You're talking about the medication?
The medications for
MS.
multiple sclerosis.
Okay.
So which means that if a person, for example, is on a daily tablet for multiple sclerosis, then what are they going to be doing for that 9 months?
Precisely.
So there are certain other options, newer treatments that have become available recently. For example, there's a certain medication might only needs to be taken once in 6 months.
Oh, okay.
So one could use one of the lesser medications that is less likely to affect the pregnancy, or perhaps try to use something that only needs to be used every 6 months. And so one takes the medication, after a few months will fall pregnant, will obviously then go through a period during the pregnancy where they need to take the medication, but just skip it, since we said that pregnancy is sort of relatively protective, and take that skip dose soon as they give birth.
Question that comes through. Assalamu alaikum. Does MS affect the bladder? Patients have to catheterize every day, 3 times a day.
Yes. So again, everything in the body is under control of the nervous system. So that is why the multiple sclerosis can have such far-reaching effects. And the bladder is no exception. So generally, the type of bladder problem can be where they have urgency, where they have to rush to get to the toilet, or they're unable to empty the bladder completely. So there's different types of approaches depending on what type of bladder problem it is. And this is assessed often in conjunction with a urologist. And they will do certain tests, which might include an ultrasound or a cystoscopy, or what we call certain functional tests of the bladder. And yes, for some patients, it's actually recommended that they use a technique of what we refer to as self-catheterization. So clean, intermittent self-catheterization to empty the bladder.
Now, let's talk lifespan. What's the long-term prognosis like?
So the condition, although it can be quite devastating, generally does not affect lifespan. People would generally have close to a normal lifespan. However, we must understand that within multiple sclerosis, there's a spectrum of disease. There's people who have benign disease and people who have very highly active severe disease. So if, for example, one becomes, let's say, completely paralyzed in the lower limbs, limited to a wheelchair, is unable to walk, then that person is going to be obviously prone to possibly developing infections of the chest and other complications, which then indirectly would affect one's lifespan.
And talking about lifespan, what about lifestyle? What effect does this have on lifestyle?
So again, it depends on the type of MS that a person has. So there's a small percentage of people who have what we refer to as benign multiple sclerosis. About 3% of people, where even they can go on like 15, 20 years with pretty much minimal, no symptoms.
Okay.
Although the evidence is there that they have the disease and we do a scan for them and we see all of the lesions, but they're still functioning quite well. Then there are those who will have moderate or progressive disease, let's say, right? So let me talk about how this disease progresses.
Mm-hmm.
So we mentioned in the beginning, I introduced the term of a relapse, right? So relapse is a condition, a state in which there's an attack on the nervous system. It results in clinical symptoms, signs, there's some deterioration in the patient's function. Then the patient recovers, possibly back to their baseline, or sometimes not completely back to their baseline.
Mm-hmm.
But what generally happens then is each time the person has a relapse, they recover, but they're losing a bit of function. So they're accumulating what we say disability.
Mm-hmm.
And this disability can be quick in some people, such that they're in a wheelchair within 5 years, whereas for others it may take 15 years, 20 years.
Okay.
Right. So this is just in terms of the motor disability.
Mm-hmm.
Besides the motor disability, it does also affect the cognitive and emotional and psychological well-being of people.
Okay.
So they can become sometimes develop secondary mood disorders, anxiety, have problems with focusing, attention, concentration. So then, even though such patients are still relatively healthy in terms of their motor skills and coordination, they're still battling to function at work or in the studies and so on. So that can be quite disabling as well. And then, as one of the earlier listeners asked the question, the fatigue, things such as bladder, which you take for granted, so genital urinary issues, all these can have an impact on the person's life. And it's important to realize that every person is an individual.
Absolutely.
And everybody's rate of progression is difficult.
Mm-hmm. Mm-hmm.
They've also used an analogy of an iceberg.
Okay.
Where we're only seeing the tip, a little bit
Mm-hmm.
is visible to us. But
Yes.
underneath, there's a whole lot going on.
Okay.
So even the relapses that we are clinically seeing,
Mm-hmm.
where a patient comes through with definite symptoms, is only the tip of the iceberg. But underneath that, there's still a lot of disease things happening that we can't actually see. And therefore, the whole concept now is shifting towards trying to treat this condition early.
Mm-hmm. Mm-hmm.
It's postulated that the early phase is sort of the inflammatory phase, and thereafter is the neurodegenerative phase. So one has relapses earlier in the disease course in the first few years,
Mm-hmm.
but then later on there's less relapses. However, the person is still accumulating disability. They're only going downwards.
Okay. So the idea is to try and detect it early,
Yes.
and then do a more holistic approach.
So if we can detect it early, stop the inflammation early on,
Mm-hmm.
hopefully we won't have a lot of neurodegeneration taking place later on.
Mm-hmm. 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 I was about to say interesting. Now, I think we've got 2 minutes before the ad break, and I'm sure your answer to my next question is going to go beyond that. But is there any cure or any treatment for multiple sclerosis?
So not a cure as such, but we have got different types of treatments available.
Mm-hmm.
So we can divide treatments into those which address an acute relapse, treatments which are meant to prevent relapses,
Mm-hmm.
treatments which are also going to be aiding in recovery, and then the treatments for the symptoms, such as the fatigue, pain, urinary issues, so on.
Mm-hmm. Mm-hmm.
And this is an area of continuous research, focus. I suppose after our ad break, we can go a bit more into what the different types of treatments that are used for each of these different aspects.
Mm-hmm. Mm-hmm. Now, having said that, we've got a minute to go before the ad break, but I know you want to discuss the different types of treatment, but are there any side effects, any complications, or is a minute too less to discuss it?
Okay, well, so maybe we'll just tackle one issue of treatment. How do we treat an acute relapse? So treatment of an acute relapse generally involves administering steroids. So this has been known from about the 1950s and was about the only treatment that was available.
Okay.
So this assists in recovery from an acute relapse when the person has got symptoms, but it makes no difference to the long-term progression. So but it's an effective treatment just for the short term to arrest the relapse.
Let's hold there. We'll take the break. We'll continue after this, inshallah.
We'd love to meet you. Pay us a visit. Radio Al Ansar.
The Watch Doctor. For watch repairs, watch batteries, watch straps, 21st keys, engraving, and sound for your occasion. Handled professionally at 263 Sparks Road, Mohammedia Center, Suite 104, Overport, next to the Sparks Road Masjid. Contact Zain on 082 542 3070. The Watch Doctor. The Watch Doctor. Keeping time every time. Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Are you or a loved one battling the disease of addiction? Is your family, life, relationships, work suffering due to alcoholism and substance abuse? Zensai Treatment Recovery and Wellness Center are addiction specialists offering specialized psychotherapy and naltrexone therapy to help overcome addiction. Zensai offers hotel-style facilities to allow your loved ones to regain their dignity and overcome alcoholism and drug abuse in the most comfortable setting possible. Fight addiction. Call Zensai Treatment Recovery and Wellness Center, the addiction recovery specialist, on 031 563 0751.
This Eid al-Adha, donate your Qurbani with Africa Muslims Agency. We ensure that your Qurbani feeds the poor, as well as creates sustainable incomes for local farmers, brings the practice of sacrifice to villages, and shares the spirit of Eid. Sponsor in South Africa for 2,950 Rand, Afghanistan for 4,500 Rand, Syrian and Palestinian refugees for 7,300 Rand, or in many other countries around the world. Donate online at africamuslimsagency.co.za and know that your Qurbani donation goes beyond borders and expectations to create a better world.
Radio Al Ansar, Durban, 90.4 FM, Peter Maritzburg, 105.6 FM.
You're listening to Medical Files, and our topic for discussion is multiple sclerosis. Our guest this evening is Dr. Hoosain Paruk, a neurologist in private practice in Peter Maritzburg. This is an interactive program, and if you have any questions, you on multiple sclerosis, you can forward them to us via WhatsApp on 060-904-1056. Dr. Paruk, just prior to the ad break, you were discussing the different types of treatment, and we just took the break. You can take it from there, inshallah.
Right. So we mentioned that the use of corticosteroids for the acute relapse. Then right until the 1990s, there was no sort of approved treatment that made a difference to the long-term course of this disease. The concept about a virus being involved in it has been known for a while, and way back, I think it was in the 1950s, they did try a molecule, gamma interferons, which was known to have some antiviral activity. But it didn't make any difference. In fact, it made the disease worse.
Okay.
So then they tried then something called beta interferons, which actually reduces gamma interferons. And that actually then made its way to become the first drug that was licensed for this treatment.
Okay.
So the beta interferons and alpha interferons that were then licensed were actually injectables, right? And they needed to be injected either daily or 3 times a week. But their effect was modest, to say, at best. And subsequently to that, in the past 20 years, there have been other molecules that have come up, and at present, I think there's approximately around 20 different medications that have received approval for multiple sclerosis. Essentially, these drugs are all what we would refer to as immune modulators or immunosuppressants in some way. And the idea is to sort of dampen down the immune system and allow it to reboot and allow the nerve cells to repair and prevent long-term relapses. As I mentioned, so there are now, apart from the injectable drugs, there are oral drugs that are also available. And then there's the newer category of drugs is what we refer to as the monoclonal antibodies, which can be taken once every 6 months. There's some which are taken once a month. Then most recently, a medication that's become available is a molecule called cladribine. Again, an old drug, but it's been formulated and sold as Mavenclad. The appeal of this drug is that it can be is taken for 2 weeks in year 1 and year 2, and thereafter you don't need to take any other treatment.
Okay.
And the effect of it so far, the data we have is shown that it can potentially last at least 8 or 10 years, maybe even longer. It's extremely expensive at present. So one of the problems with all of these medications is funding.
I know.
Because a lot of research has gone into it, drug companies want to obviously recuperate what they've put in and then obviously make a profit out of it. So they're all very expensive. And for example, cladribine is an old drug and it should actually be cheap.
Cheaper, yes. Yeah.
But it's just incredibly. So what I told you now, just taking it for those 2 weeks, cost close to, I think, around 400,000.
400,000.
Yeah.
Okay. There's lots of questions that are coming in now. So maybe I can just do. Okay. Assalamu alaikum. Can you please shed more light on a treatment called Obagio?
So Obagio is, yeah.
I am diagnosed and there's more lesions on the MRI scans. Obagio was recommended as an option. I am so confused after reading upon reviews. I'm trying to avoid further disability. I have been 9 years not on medication and relapse free. Please shed your thoughts on this one, please. Jazakallah.
So Obagio is teriflunomide. It's an oral drug. So when it comes to these medications now, we can sort of grade them into those which are sort of low potency and which are high potency. So there's two different approaches to it. One can use a step up approach to start with something that's low and then escalate, or alternatively hit hard right from the beginning. So that we mentioned earlier, we want to try and stop the inflammation at the beginning, so that long term you have less degeneration.
Yep.
So yours is the listener situation is one where she's maybe not having clinical relapses, but there are still lesions on the scan. So I think this needs to be quantified. The scan needs to be assessed. As I mentioned earlier, perhaps what we're seeing as relapses is only the tip of the iceberg, but there's still disease activity that's continuing. And Obagio would qualify as one of the lower potency drugs. It's an entry-level medication. So there are certainly more potent medications that could be used in her situation.
So how effective is the tablet called Mavenclad? That's another question that's come through from another listener.
So that's the one I've just mentioned. From what we're finding so far, very effective. If cost was not a factor, it's probably, and if you had to choose a medication, and if cost was not a factor, probably Mavenclad would be the way to go.
But that's 400,000 rands.
Yeah, but potentially you're going to look at the savings. You're not going to be saving on hospitalizations. You're not having to use the medications for a long period.
What about what you suffer? Better quality of life.
Yes.
Does family history play a role in this disease?
Yes. So as I mentioned, it is a slightly increased risk, but it's not 100% that the child will be affected. But yes, if you have most conditions in neurology, if you have a first-degree family member who is affected, then it is possible that a person might be affected. But there's no genetic test that you can go and do to see that you are going to develop MS or not. So I don't think that one should sort of preoccupy themselves and worry about it excessively, that I've got a family member who has this, am I going to be getting it in the future or not?
Okay, from Brother Yusuf, there is an alternate cheap drug called naltrexone, taken in low dose, that gave remarkable recoveries and improvement in symptoms in MS, in multiple sclerosis, in some patients in the USA. Some patients supposedly coming off wheelchairs and could walk. Do neurologists generally use this drug?
So what you're referring to, what was the drug?
It's called naltrexone.
Naltrexone. So I'm not sure about its use in multiple sclerosis. Would have to check that up.
Okay. Are there any side effects of Mavenclad?
Yes, the side effects with all of the medications, and but I mean it's relatively low. Because it is affecting your immune system. You would be at risk of getting infections. Generally, before patients are started on these treatments, they have to be screened to make sure that they don't have any active infections. And our setting, particularly important to screen that they don't have TB.
I think we've answered this question that just come through. What is the life expectancy of with MS? That we've discussed that already, but you can just touch on it very quickly.
Close to normal.
Close to normal. And what happens after 8 to 10 years once taking Mavenclad?
Well, because the trials haven't gone on so far, it's a relatively new drug, but so far it seems like most patients don't need to take any other treatment.
Okay. All right. We've discussed the cost of treatment. Let's talk about monitoring of treatment response. How does one deal with that?
So one looks at whether a person's having relapses or not, and then one repeats the MRI scans to see whether there are new lesions or not. We would look to see whether the lesion load has increased, and when we're assessing the scans, we would also look to see whether there are any active lesions. So when a person goes for the scan, they would also be injected with contrast, which is a dye. And active lesions take up the dye, so they light up on the scan.
Okay. There's a voice note that coming, but I can't play a voice note, unfortunately, so I'll have to skip on that question. I think we've got like 3 minutes left or 2 minutes left. I'm sure you have some advice for people living with MS.
Yes, so I think it's important for them to realize that there is help that's available. It's important to try to adhere to as healthy a lifestyle as possible. So that's positive thinking, healthy diet, exercise, seeking appropriate medical help, knowing what medication is out there available, making a decision that's suited for them, using the treatment, monitoring the disease response, and still trying to live as healthy a lifestyle as possible. And the formation of support groups, also all these helps an individual MS to continue to live as a fulfilling life as possible.
What about some advice for the family members? I mean, if one of my family members has got that, how do the rest of us deal with it?
Again, the thing is something to realize. It's not that it's a death sentence.
Understood.
Right? Yeah. It's a chronic condition. Yes. So it's a journey. I think it's important to provide the support and to know that there are treatments available. I mean, I've just mentioned the sort of disease-modifying treatments, but there are, in fact, and in this condition, with all of the other symptoms, we're quite open to embracing complementary and alternative treatments for the treatment of the pain, spasms that one has. So, one can look at massage therapy, relaxation techniques, acupuncture, so on. If it helps relieve a person's symptoms, then, no problem in using those techniques as well.
And I think family members need to be supportive. And
yes.
Yeah. But I think I did pose this question to you earlier. In fact, it's come up again. And we've got like a minute left. Can a person live a normal life when one suffers from this condition?
I think it would depend, because it's such a spectrum. So you've got a few who's going to be having the benign MS we mentioned, where they have pretty much relatively no problem for 15, 20 years. And you're going to have a subset, unfortunately, who are going to have the highly active disease, where despite the treatments, they are going to continue to have relapses and new lesions appearing on the MRI scan.
Dr. Hoosain Paruk, I want to thank you for joining me in the program this evening. Alhamdulillah, it's very, very informative. And I want to thank the listeners that have forwarded to us the various questions. And I want to thank the engineers who have engineered in all these, the various radio stations on this particular program. And Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. And before I leave you, I want to say to you that may you be in the care and protection of Almighty Allah subhanahu wa ta'ala. Until we chat again, for myself, Faizal MJ Suleman, do enjoy the rest of the week. Assalamu alaikum wa rahmatullahi wa barakatuh.
An informative Islamic global perspective. This is Al Ansar News.
Making news this hour, the 28th of May, the news from Durban 90.4 FM, Pietermaritzburg 105.6 FM. Police in KwaZulu-Natal ensures safety in tomorrow's elections. American Monina Police Commissioner in KwaZulu-Natal, Hlanhla Mkhwanazi, says there are security preparations for tomorrow's elections. He is elaborating.
1,000 public order police unit members in this province. There was an addition that was deployed. I'm sure you might have seen yesterday. The National Commissioner paraded them and he deployed them to come and join us. I think the total of those that are going to come from the head office, they are about 700 or so. But not only 700, we can also count the members that already been deployed in KZN in order to help us to deal with illegal mining, in order to help us to deal with the crime in the Mango's area, the vehicle crime. All those members that were deployed for that purpose during this period, they're going to join their fellow colleagues in terms of the IEC election operation.
Staying with Mkhwanazi, he says they anticipate